Welcome to a very special episode of From the Heart. Today we have the privilege of speaking with Amber Adamson, a dedicated clinical nurse consultant at Prince Charles Hospital. She specialises in adult congenital heart disease. In anticipation of this episode, we put out a call on social media for your questions and concerns, and you responded with fantastic queries that truly cover the spectrum of living with a heart condition. So Amber is here to help, specifically addressing the concerns and questions of young people and adults.
There's a huge emotional part, there's a huge mental part to it, and just having someone that has that understanding to come to about things that they feel that they may not be able to talk to with doctors or their parents is one of my favourite parts of the job.
Before we begin, we would like to acknowledge the traditional owners of the land of which we record. We pay our respects to elders, past and present, who are part of the world's oldest continuing culture and the first storytellers. We acknowledge the importance of supporting health for all peoples, now and in the future. Aboriginal and Torres Strait Islander people are warned that this podcast may contain the voices and names of people who've passed. How are you feeling? Are we ready? Are you excited?
We're good. Let's do it.
Okay, let's go. All right. We are really eager to learn about kind of how you manage to specialise in heart conditions. I think it's really interesting in my own experience being someone with a heart condition. I don't really know many people that are like me until I kind of came into HeartKids. So I'm really interested as to how you decided to specialise. Tell me a little bit about your journey to get where you are in your career now.
Yep. And just before I quickly deep dive into it, thank you so much for having me on this. It's actually an honour to be here. And I hope this can all be of help to all the heart kids that are listening, particularly our teen and young adult audience. Yeah, so I suppose my motivation, I think in the grand scheme of congenital, mine was very little. Was born with an ASD, which was monitored quite frequently in childhood with, your standard routine echo specialist appointments. And luckily for me, that sort of closed up by the time I was about 12, 13. And then I saw myself back into the cardiology world as such when I was about 19, having some decent arrhythmias that sort of landed me in coronary care and the cardiology wards for quite some time. And I think just having that experience, though, just seeing how lovely the nurses were throughout that process and how interesting I found like the anatomy and how everything works within the heart, I actually decided to apply to uni pretty much straight after that. Got straight in. From the first year of uni, I was like, yeah, it's cardiology all the way. I was just, from the get-go, I found that myself and the congenital patients were just clicking, and I just absolutely loved nursing them. And fast forward, here I am in the clinical nurse consultant role for adult congenital, which is amazing. It's a dream come true. And yeah, if I could do this for the rest of my nursing career, I would be incredibly happy with that.
Beautiful. I think it's a beautiful thing to have somebody like yourself that understands the world, has been through experiences, but also in terms of beyond the crisis point. So when we hit adulthood and what management of these conditions look like, and having someone like yourself on board during that, what is it that makes you love the job?
I love having a positive impact on the patient's experiences. The cardiologists are fantastic at managing them clinically, but I think that a nurse side of things just offers that extra sort of TLC, I suppose, in a way that I think congenital cohort of patients really require. It's not just clinically what's happening, there's a huge emotional part, there's a huge mental part to it. And just having someone that has that sort of understanding and concept of what's going on. Not to say that cardiologists don't provide that, but I think when a nurse comes in and they can manage the other aspects of what congenital kids and adults go through, I think it's great for them to have that person to trust and come to about things that they feel that they may not be able to talk to with doctors or their parents or other people that manage their care. Yeah, I think just coming in from that perspective is one of my favorite parts of the job.
I love that. And look, seeing as you have a wealth of knowledge, I'm very excited to pick your brain. So we did a social media call out. We got heaps of questions from people. So if you don't mind, I might dive into it and pick your brain about a few things.
Yeah, let's go.
Let's go. All right. First cab off the rank is a common one, particularly when you are young, you're coming from early childhood experiences into the adult world. What is the risk, or what happens when we drink alcohol or we take drugs with a heart condition?
Yeah. No, I think this is a really great question because, of course, there's always going to be a point in one's youth that wants to drink alcohol and or do drugs with friends. We totally get it. So there's absolutely no judgment with these kind of questions, even face to face. But I'm glad someone's asked the question because I'm sure there's quite a few of them out there that would like to know. So I think, yeah, first and foremost, it's just really important to be honest about it to the doctor or the nurse who's managing your care. We don't judge you or lecture you. It's just best for them to know when it comes to things like managing medications, starting medications, perhaps levels of anesthetic that they might have to use and procedures or surgeries. When you drink things like alcohol in excess or take drugs in excess, a lot of that can promote tachyarrhythmias, which our heart kids are already at such high risk for, if not already experiencing. So to then throw the alcohol and drugs on top of that, I think that's also something to be mindful of. Excessive amounts of alcohol and drugs can also impair your kidney function, your liver function. And if there are already things that you're living with from, say, medications, other congenital defects, or in our Fontan patients who already have, a Fontan associated liver disease, and then you go and drink excessive amounts, like it's obviously going to put extra pressure on your liver. So I think being aware of that. And I'd also say just engaging in alcohol or drug users, you've got to be mindful about what medications you're on. Like warfarin is a big one, I think, just to quickly touch base on. It's a blood thinner that people take when they have mechanical valves or Fontan circuits that require blood thinning medication. And when you drink alcohol, it already prevents blood cells from sticking together, which is also known as platelets. And so you add the two together and you've got a higher risk of bleeding events. So yeah, look, to be honest, I think it's always recommended to have a lower alcohol intake, but it's just incredibly important to know, what medications you're on, how that's impacted when you drink alcohol, and what your baseline level of kidney function and liver function is to begin with. But yeah, as I always say, important to have that kind of discussion with your treating cardiologist or your nurse and just being completely honest about the level that you're doing.
Yeah, beautiful. I think that's the thing, isn't it? It's better to be informed and have all the information and to be honest about it, because you never know what kind of situation you'll end up in. But in the same kind of strain, obviously vaping is huge. It's the new thing. In terms of vaping and even smoking, are we looking at the same kind of conversation?
Absolutely. Yeah. I think smoking, vaping, full of harmful chemicals, we truly don't really know what's in them. But I say they have more of a long-term detrimental sort of effect on your cardiovascular system. So smoking and vaping, they promote coronary artery disease, strokes and whatnot. It can impact your lung function, which then impairs your ability to recover from things like open heart surgeries and procedures. It has vascular side effects, such as problems with wound healing that you may need after having surgery. We're not here to judge you. It is important that we know so we can make informed decisions moving forward and have those expectations that if there's coronary artery disease or chest pain moving forward, or you're having breathlessness, it's good to just know what you're doing and how much you're smoking. And I think all we can do from a health practitioner side of things is to educate. And as long as the patient is completely informed about the side effects and the risks moving forward, then all we can do is just support them and know what's to come in the future when they present with particular symptoms. Just be honest about it. Help us help you. Really.
I think that's the thing, isn't it? There's always that kind of fear of judgment entirely, but people are just saying, be informed, have a conversation, be open about it. Changing the scene a little bit in terms of lifestyle management. Growing up, I can remember my parents always being told, don't engage in exercise, don't do that. Now it's a very different conversation that we're having with the exercise space. From your perspective, I guess, how much exercise or what type of exercise should somebody with a congenital heart defect be doing?
Yeah, no, it's a good question. I think the exercise capacity should be individualized to each person's conditions. I think, yeah, of course, there's that overall consensus that, I shouldn't be exercising or exerting myself, but generally that's actually not the case. So there's a lot of benefits that are included with exercise, particularly in our congenital heart cohort. So you've got reduction of cardiovascular events such as strokes and coronary disease, diabetes. It helps with stabilization of weight. It improves muscle mass, endurance, can help with body image that I think a lot of congenital heart kids already really struggle with, and confidence. But I think most importantly, it has such great mental health benefits, like to reduce stress, reduce anxiety, which we see a lot in this cohort of patients, which is completely understandable. But yeah, so in terms of actual exercise, just a really good mix of the aerobic. So you're walking on a treadmill, going for a walk outside, getting some fresh air, walking up some steps here and there, and also some resistance training. So your weight training to build up that muscle mass and whatnot. Low impact, in my opinion, is best for so many reasons. But yeah, I think this will all very much be dependent on the patient's anatomy and like tolerance.
Yeah, totally. I guess in terms of what you were saying about low intensity as well, I know that can't speak for everyone, but I know for myself, I have an aversion to high intensity cardio. Number one, I hate running. And number two, heart rate goes through the roof. So I do tend to do a lot of strength-based exercises, but I have heard that also can put a pretty intense strain on your heart if you are doing it at quite intense levels. In terms of like weightlifting and heart health, I guess where's the happy medium between building strength and building muscle, but not putting extra pressure on your cardiac system?
Yeah, it actually, like in terms of weightlifting and safe, I suppose, limits with that, this gets brought up quite a bit in clinic, and in particular by a lot of our male cohort of congenital heart patients as well. So when you're lifting weights, you get this sudden rise in your blood pressure, which, it just increases the demand for blood flow and cardiac output, which in our terms would ultimately result in an increase of myocardial oxygen demand, where your heart rate increases, there's wall tension and contraction of the ventricles, and excessive amounts of this can cause decompensation. So I think working again with a cardiologist and an exercise physiologist for safe weightlifting restrictions and numbers, I think is the way to go, just because every patient's so different. And I think not overdoing it. I think it's all about listen to your body, right? Like in my opinion, most congenital heart kids know what they can do and know what their threshold and know what their limits are. So I think when you're excessively going beyond that, you need to probably rethink your training program or how much further to go. But I think most congenital kids are really good at knowing how far to push it and when it doesn't feel quite right.
Yeah, totally. And I think for people heart kids who are looking at that being like, I have such an aversion to it, or I want to do it really well and I'm disappointed that I have my limitations. We have elite athletes in our community. Like our bodies do have this capacity, but it is exactly what you're saying, working in a safe way to know if we want to achieve a goal, how do we do that in a way that sustains our safety, our health first. Now, in terms of traveling, preparing for a trip, whether it's overseas or domestic travel, are there any precautions or preparations that should be at the top of the to-do list when thinking about traveling?
Yeah, first and foremost, let's start with travel insurance. Super important. I think he's about 19, so recently transitioned, and he's going to Bali for the first time, and he's super excited. And he's like, what do I need to do? What's important? And I was like, okay, you've got your travel insurance. Tick, super important. Let's get a list of appropriate hospitals that you may need to go to. So I suggested a different couple of hospitals, one maybe for emergency accidents and one if there's something cardiac going on. Ensure you have an adequate supply of your medications so you're not running out overseas. I'm always very pro taking your clinic letters everywhere you go, so that when you present to a hospital, you don't have a doctor that's never met you in his life trying to assess what's going on. So if you go there prepared with your clinic letters, and most of the clinic letters will have what your echo shows, what the management is moving forward, what the plan is moving forward. And then I think that also gives the doctor who's treating you overseas, if it's super necessary, they can see who the treating cardiologist is and get in contact with us for advice on management. So yeah, in terms of things like food poisoning or barley belly, very much ensure you're drinking bottled water. Like anywhere that you can lessen your risk for infection, particularly our valve patients and things that are at higher risk for infective endocarditis, ensuring that you're not putting yourself at risk for infection. I think in terms of like potential infection, like if you were to go overseas and fall off a motorbike or eat bad food, most of the doctors overseas will be able to treat you with antibiotics. But I think it's important to let your cardiologist know where you're going and what the plan is, because they could even potentially give you a plan of, okay, if this happens, this is the particular antibiotics that you need to take. Or it's the same thing as like when you go for dental procedures, like the HeartKids, you need dental prophylaxis and things like that to prevent endocarditis. So it would be the same sort of concept. And then just ensuring you've got contact numbers on you. And I suppose if you're already on blood thinners, great, but just being mindful of things like DVTs and PEs and whatnot, especially on long haul flights. Get up on the plane, walk, like as much as you can, increase that circulation. Yeah, just being mindful of like things like that. But Definitely travel insurance. Take your clinic letters that has all the information on, have contact numbers ready to go, have particular hospitals that you would want to go to in an emergency, ensure that your medication is filled, and be very cautious of eating bad things, drinking bad water, and being very mindful of when you start feeling a little bit off, because the sooner that you intervene, the better it's going to be for you.
Yeah, beautiful. I love that. We used to travel a lot when I was a kid, and my mum would always, in every suitcase, she'd have an extra packet of amoxicillin. And I
Yep.
tell you what, that came handy many times.
I
Your
bet it
mum.
did.
Thank
I
you.
bet it did. Love that.
That's
Thanks,
it.
Mum. You're the
That's it.
best.
That's it. Now, the next question is one that I'm actually very interested to know. I'm getting on the ripe old age of 27 this year, so I'm feeling a fatigue about myself that I didn't have in my former years. I guess in terms of aging, we age differently. We have a different medical, I guess, timeline that a normal population would. Will my heart condition or will somebody's heart condition get worse as we got older? Or how do we manage or how do we distinguish between a heart condition or something probably going wrong in our system versus signs of aging and fatigue?
Well, that's a good one, actually, isn't it? I think it comes down to just ensuring that you are coming to your clinic appointments regularly. And if a doctor says 6 month follow up, if a doctor says 1 year follow up, it's important to do that, because they suggest those timeframes for a reason, whether there's early signs of valves deteriorating or a decrease in your oxygen saturations or changes on your ECGs. So all of those things, when you come to clinic, will be picked up very well by the cardiologist. They go through a very rigorous training fellowship for congenital, and they're super amazing at picking up things that are relevant to your condition quite early on. And I think attending things like your echoes and your CTs and your MRIs to assess what the pathology of your heart is doing is super important. And I think if it's going to be anything that's actually relevant to the disease process of your heart defect, it will be picked up through your clinic appointments and through your imaging that you routinely attend. Some patients need 6 to 12 month follow-up, some need 2 years, some needs 3 years, and just ensuring that you really are attending those appointments, because yeah, that definitely will be the place that things get picked up. And I think it's important that if you're having things like, oh, I'm short of breath, but oh, it's probably because I'm getting into my 40s or 50s now and I'm just getting old. Okay, sure, you may think that, but I think that it's really important to still disclose that to your cardiologist.
Yeah, totally. I think the big thing that's been really good for me is to know that I can send an email to my cardiologist and they'll
Yeah,
get back to me. Like it doesn't have to be a whole appointment.
there you
So there
go.
you go.
See, and I think most congenital hospitals that have that access where you can, like for us, you can call us or email us anytime and we'll always get back to you. And if we don't know, we just escalate it to the cardiologist as well.
And look, I feel like I've been having family planning conversations since I was like 11, but
Mm.
there is, regardless of being in those conversations, there are still so many questions that go left unanswered. I feel like a lot of the time conversations can happen above our heads between specialists and not so much with us in the middle of it. In terms of pregnancy, family planning, I suppose starting at level one, engaging in safe sex,
Yeah.
what, in terms of heart conditions, what contraceptions are the best options?
So generally, all contraception is safe. Unless you have a cyanotic sort of heart disease or you've got this like right to left shunting, it's just best to just not have something that's got estrogen in it. So those cohort of patients should be having progesterone only. So things like the Mirena, Implanon, there's progesterone only pills, depot injections, they're really good alternatives. And this is also relevant for people who have a history of clotting like DVT and PEs. So definitely no estrogen for that cohort of patients. Yeah, if you don't have any of those particular conditions, then you're open to whatever you want in terms of pills, injections, marinas, whatnot. Condoms as a sole contraception, we tend to advise against. It's only really got an 80% success rate, and it's best to use those in conjunction with contraception, but not as a sole contraception, because congenital heart kids and young adults and teens really need extensive preconception counseling. We can have that preconception talk with them in regards to what's best, which is going to be safe for everybody involved. Yeah, I'll always stress the importance of that.
I do want to pick your brain really quickly as well in terms of, I guess, unplanned pregnancies
Mm.
and thinking about terminations or what the process is if you are in a situation where you are not able to pursue the pregnancy to term?
Yep. So I think if you already see a congenital cardiologist in a sort of tertiary hospital, they will know people within that sort of health service that can help with that. So it's a matter of just referring. So like for us, for example, like Kylie Burns, who's running our pre-con counselling here, congenital clinics here, but then does the high-risk birthing management over at the Royal, that's someone that you can refer to just to have a discussion about that. But if it's something that you would like to go ahead with the minute you find out, getting that referral made to someone that can help you with that. But I think it also really needs to be done in a high-risk obstetric hospital that can facilitate the counselling with that and also the after effects moving forward, especially because if you're going under for that sort of stuff and sedation, you don't sort of want anyone doing that isn't aware of your congenital heart disease and processes.
Beautiful. Yeah, that sounds great. I have a really great gynecologist who works very closely with my cardiologist, and she has a whole plan. She just does it all, and she knows who to call, where to go, what to do if anything like that or anything happens. So gynecologists that worked with cardiologists, love them.
Yep. And if you live in a rural, remote area and you're really only coming down to these sort of like tertiary centres to be seen in our clinics once or twice a year, I think the easiest way to get in earlier to have that conversation or have referrals made is to see your GP and get them to refer into us or wherever they're being seen so that we can see that referral and triage it accordingly and get that happening for you.
The next question that I have for you is actually quite a big one. And I know that a lot of people have these conversations when they do look at seriously family planning. What is the likelihood of passing on a congenital defect to your child?
The percentage is lower than what people think. There's a lot of different evidence and a lot of different papers, but then you talk about, okay, I'm the only one with like TOF in my family. What's the risk of my baby having something similar or any form of congenital heart? 4 to 6%, really. Yeah. It is a little bit different when it's a genetic congenital. So when you're talking like your Marfan's and your aortopathies and it's all like genetically driven, then yeah, the risk is higher, of course. And that, again, will be talked about in things like preconception counselling, or if you're seeing like a specific Marfan or aneurysm or congenital cardiologist that's specialising in aortic issues or genetic issues. Yeah.
When we talk about non-genetic congenital defects, when it's non-genetic, is the likelihood, so if your bub does have a congenital defect, as you do, is it similar to what you have or can it be anything? Is there a connection there?
It can be sort of anything. As a whole, I don't think that there is specific evidence or research that will suggest that.
I remember getting told when I was young that there is a likelihood that you can pass it on to your child, and just getting so distressed about that and not knowing, not having the stats, not having the understanding when I was younger, but also realizing, I remember having a conversation with my dad about it and him being like, well, you've done it. And mum and I have knows what it's like to have a kid with a CHD. So you've got 2 generations that are all over it, who know the healthcare, who aren't doing this for the first time either. So I think that's the biggest thing. I think I was told, 5%. Whenever I get asked that, I'm going to pass it on to your children, it's nothing that I'm unfamiliar with.
Yep. I think that's such a good point. Like, at least you're armed with that wealth of knowledge and experience.
Exactly. In terms of the healthcare system, we talk a lot about the process of transitioning from like a children's hospital or pediatric care into adult care. I guess, what are the major differences in the systems? And when you're engaging with adult doctors, what is the difference there?
Yeah, some of the differences is that we expect you to be a lot more independent. When you come over here, generally mum and dad aren't coming to appointments anymore. We tend to take your number and we'll send you text appointment like that you need to confirm to. And the same goes for all your imaging, like your echo and your stress testing. That will all go to you to confirm. And we definitely try to instill a little bit more independence with all of that sort of stuff. If you require a carer and things, of course, that we would still carry that on. But if you've got capacity and normal living, then we tend to ensure that you're the one that's getting the appointments and changing appointments and just becoming a little bit more independent in regards to that. And if you're having changes in your conditions with your chest pain or like breathlessness, like we want you to be calling us about that. We don't want mum calling us and saying, oh, little Johnny, he's having some chest pain and he's not able to walk as far. It's like, okay, but he's 18. So can he call me? Like, I want to know what's happening. I want to talk to him and really get his side of things. So we expect that you're the one calling us with that kind of stuff. In terms of like when you come to your first appointment as a transition kid, the nurses will go down to the clinic and have a chat with you, and we give you a little booklet about what life is like in the adult system. That'll tell you what to expect, the importance of having a relationship with your GP, like making decisions for yourself, standing up and asking for things that you have concerns or questions about. Like, we expect that you come here and you know what you've got, what your condition is, what your medications are, and why you're taking them. Whereas I think in the pediatric side of things, that's all managed for you, and it's this is what you need to take, and mum does that and dad does that. But here it's you're responsible for that. But I think, yeah, the Children's Hospital are doing a lot of work. I know up in here it's still a bit of an ongoing process, but in the lead up to their sort of last couple of appointments with the pediatric congenital team, they have this checklist that says it's not an exam, but it's a bit of a, okay, what's your condition? Explain to me. What medications are you taking? Who's your GP? Or what's your GP's contact details? Things like that to get you ready to transition. So we're trying our best to start that early on in the process so that you're not coming over here and it's this massive shock horror. But yeah, I suppose, yeah, to summarize, the biggest differences is that we expect independence. In terms of the difference of cardiologists, like, they're amazing. They're not like big, bad, scary, old cardiologists that are like, they're really understanding, and they chose to do congenital fellowships and training for a reason. All the cardiologists that I work with personally have a very good understanding. I think that they're very welcoming.
They're all quite soft and sweet.
They are. Yeah, they're all really lovely. Big shout out to the consultants that I work with here because I absolutely love them all. So yeah, I think they're super great.
And look, as you were saying before, I think it can be really intimidating to all of a sudden step up and have to be independent. And I know for myself, my mum had always looked after my care. My mum, I think it was very much something that she took on a sense of control in a lot of the hectic times. And look, I have absolutely no problem standing up for myself outside of my life, but I do get triggered in medical situations. Obviously, growing up in a medical setting, I'm a fawn responder. I find it very hard to say when I'm uncomfortable with something or to voice up when I know that the people around me are trying to do the best for me, even though I'm just uncomfortable.
Yeah.
I think for you on the other side of that kind of interaction, if somebody is uncomfortable or you can sense that something's going, what's your advice to that person when you can see that nervousness about saying something? And I guess what is the importance of advocating for yourself as a patient in a clinic and making sure that you do have that voice?
Yeah, no, super important. I think utilizing the nurses first and foremost, I think, is your sort of first line there. You'll have our number, you'll have our email address. Please call if that's how you're feeling. Like, there's been numerous times where I've had patients have that feeling of they don't feel that they can speak up, or they don't feel they can advocate, or they're sitting in clinic waiting to see the doctor and they're like literally a nervous mess. And I've had people come from up north who are not familiar with big sort of tertiary hospitals, and they're like calling me and they're like, I don't even know where to go, I'm stressed, I don't know what to talk about, I feel like my knowledge about everything is not great, I don't know when to ask questions. And I'm like, say less, meet you down in clinic in 5 minutes. I think just reaching out and having that sort of nurse contact to fall back on is really important. And I think a lot of people don't want to use that. But again, that's why we're there, to help support you. And I think I mentioned very early on in the podcast, that's one of my favorite aspects of congenital nursing, is being able to be there for people emotionally and mentally. Because I think it's just something that a nurse can do. It's within us. We have that caring nature, we have that supportive nature. And so leaning onto nursing staff in the congenital program to help you with that sort of thing, I think, is super, super important. I think if you're still feeling like your concerns aren't being heard, or you actually feel like you're advocating and things aren't being changed, most hospitals will have like a complaint liaison service that you can contact or email or phone. And it's as easy as saying, I'm uncomfortable because I feel that I've advocated for this and nothing's getting done, and I'm frustrated with the system and I don't know where to go from here. And that gets escalated like quick, and responses are expected from the team. And if it needs to be escalated to directors and hire people to sort it out, it will get sorted out. So you've also got that. In terms of the inpatient side of things, like if you're scared to speak up or advocate, but you feel like something's not right and things aren't happening in a timely manner and no one's communicating, there's Ryan's rule. I think that's actually a nationwide rule. I'm not sure if you've ever heard of that, but it's something that you can call in hospital, or your friends can call, or your family can call, and it literally gets escalated to like the director of medical services for that hospital, and it goes to a superintendent and all these like big people, and it gets like sorted out there and then. But I think as well, bringing a support person, I'm really big into that. If you've got a parent, a friend, a sister, brother, cousin, whoever you feel is good to have around, makes you feel good, makes you feel calm, and maybe someone that is comfortable with speaking up on behalf of you, I'm all about it. We really support that, because sometimes as well, like you're not taking things in when you're in that state of mind, and having an ear there next to you that's taking that in because they're not in the hot seat, to then talk about that with you afterwards and having someone to debrief, I think is a really good way. And having a diary or like a notepad before you even come in, it's okay, these are the questions I want to ask, these are my concerns, and you can literally just bring the notepad out and be like, these are the things I want to address. So I think just having those avenues to fall back on are super important in terms of advocating for yourself and your heart condition, really.
Yeah, totally. I've started to voice record my appointments.
Oh yeah.
I find that when I'm in them, I just get very overwhelmed and I ask questions and I get out and I'm like, oh yeah, I think that was fine. And I like sitting down with my doctor and be like, do you mind if I voice record this so I can listen back to it and I can like take the advice that you give me and not forget about it when I leave the room?
Yep.
Also, if my mum gets anxious, she can listen to it as well.
Absolutely. Yeah.
So,
yeah, totally. Yeah. No, it's a good idea. Obviously with the consent of the cardiologist, like you said. Yeah, because they're like, oh, why are you
do not illegally record them.
Yeah, no, do not do that. But yeah, if you're just someone that recognizes that you're not going to remember half the things that are said, and it's really important after you leave to relieve anxiety or stress that you may have from that appointment, yeah, why not? Whatever works for you.
Beautiful. I have a bit of a random question that I do want to ask you as well, and it does go back to what we were talking about in terms of aging and knowing your system and calling up when you need to. Some of us have valve replacements within our hearts. On average, how long does that valve last, and what does the process look like to get that renewed?
I think it's, again, going to be very case dependent, and there's obviously a lot of contributing factors that will degenerate a valve. Particular types of valve will degenerate quicker than others, but as a whole, you're going to get roughly 20 years out of a mechanical valve. And I think that's so cool. You've got other things like bioprosthetic valves and things like that, which I'm not super clear on the numbers, but mechanical valves, we're definitely looking at around 20 years.
In terms of scars, I have a bit of a random personal question.
Yeah.
As well. I have always been interested. So obviously I have my zipper scar. I've got one on the back from like day one, and I've got my Fontan was 1999, so I was 2. I love it. I have no ill or great feelings. I have quite apathy when it comes to my stars. It's just there and I'm okay with it. But I often think about in terms of later on down the track, if I do have a Fontan revision and seeing as I already have the scar, it always grosses me out a little bit. But would they reopen that same scar?
Yeah.
Oh, okay.
And I suppose that's just the nature of the beast with congenital heart, isn't it? It's awful. I know. But, lots of medical advances in the world happening, and
that's it.
Now they're just accessing groins, and
that's it.
Where else can we go?
That's the thing. When I was younger, the way that my dad would like look after my mum did so much that my dad was like, I'll do the scar looking after. We used to get the vitamin E capsules and push out, and then that's how. So I've got a very happily healed scar now. Thank you, Dad. But in terms of scar care, what is your advice to people who are coming out of surgery and do have to look after? Because I imagine bio oil probably doesn't cut it.
Bio is not overly going to cut it, but I'm super big on the vitamin E. Yeah, I think that's so cool. And how long ago was that now? 27, 26 years.
Yeah.
And they were using vitamin E. Like, so awesome. That's literally what I would say is like vitamin E is going to be your best thing. It will never completely get rid of your scar. Like, it's impossible to ever completely get rid of it. Most hospitals will have like wound care nurses who generally will only really consult patients with really nasty wounds that need a lot of care, but they are really great at knowing certain products and things out there that you can access to minimize the scarring. But you can't go wrong with vitamin E.
The way to go.
Yep.
In terms of, I suppose, things on our bodies, tattooing, what is your advice?
Look, I think if you're going to do it,
Yep.
be honest about it, but knowing the risks, of course. So when you put a pin or a needle to your skin, there's always risk of introducing bacteria, right?
Yep.
So this kind of bacteria can travel through your veins into the circulation system and it gets filtered around. So let's avoid that, particularly in those with like valve issues, valve dysfunction or disease, and those with like right to left shunting, because these are like your highest risk factors for bacteria. Like I think the Australian hygiene standards for tattoo shops is pretty high. So I think just doing your research is really important, and just having that discussion about, hey, I really want to do this. I know there's like a lot of risks involved, but is there any way that we can talk about prophylaxis with antibiotics? And this place has like impeccable hygiene standards and I'd really like to go here. I've always said about everything else, be honest about it, because most of you will require prophylaxis for dental procedures. So let's talk about prophylaxis with tattoos.
Yeah, beautiful.
Yeah.
And look, they are almost all of my questions. I have one left for you. And I guess with all your expertise and all your experience, personal and professional, what is your like top nugget of wisdom for living a full and happy life with a heart condition?
Attend your appointments, first and foremost with the doctors, and your imaging with your echoes, MRIs, CTs. Know your condition off the back of your hand. Know your medications. Take your medications, please. Ask questions, like advocate for yourself when you don't know something or you feel that something is not right. Exercise and live a healthy life as much as you can to your capability and condition, and prioritize your mental health. It's such a big thing, like finding support people to lean on, attending counseling or psychology sessions regularly. I think that's such an important factor to living this like full, happy life with a congenital condition. Form relationships with other heart kids as well. Like I recently went up to a heart kids camp on the Sunshine Coast and had a chat kind of similar to this with some of the pediatric nurses. And I think it was so nice to see these like young girls forming friendships with other young girls that are in a similar situation with their sternotomy scars and stuff, because you understand what each other's going through. It's the same thing. Yeah. So I think just doing that, prioritizing self-care, journal, if you will, and try not to limit yourself too much based on the fact you've got a condition. Like I understand some patients are living with more like palliative type conditions and they're extensively limited to what they can do. But I think getting out of that mindset of, oh, I'm a congenital kid, so I can't exercise, I can't do this, I can't travel, I can't go out to parties with my friends, unless that is specifically contraindicated for whatever reason, please go and live your life. There's this stigma, of course, that like, I can't do things, but you absolutely can. And I think with the right advice, and as long as it's safe and practical, just listen to your body. You'll know when something's not right. But otherwise, just live your best life. Seriously. Get out there. Do your thing.
100%. Attend your appointments and give yourself one hell of a chance.
Yes. You can totally live a normal, healthy, happy life. You really can. We're always here to call or email if you're not sure of things. Just ask us.
This podcast deals with some heavy things. If this brings up anything for you or somebody that you love, it's important to reach out for help. The HeartKids helpline provides support, advice and guidance for people impacted by childhood heart disease. You can call the helpline on 1800 432 785. To access more information about childhood heart disease as well as support from HeartKids, visit the website heartkids.org.au. The information on this podcast is not a substitute for medical advice from your doctor or healthcare team. Always talk to your doctor about matters that affect your health or your family's health.